5 jaw-dropping medical procedures that may or may not still be used today. You're gonna wanna hear this. Today's medicine is state-of-the-art and boundary-pushing. Medicine in the past, however, not so much. Truly barbaric and terrifying procedures, all in hopes of advancing medicine
for the future!
Today, we are breaking down 5 past medical procedures that were shockingly used to treat patients. Plus, are they still used in medicine today?
Set vent temp to 42 for me.
Number 5 terrifying medical procedure, bloodletting. Nowadays, in modern medicine, losing a ton of blood is a bad thing. The goal is to stabilize the person and stop the bleeding as soon as humanly possible. But what if I told you that this was not always the case? In fact, doctors encouraged blood flow. For thousands of years, bloodletting, or removing the blood from a person with the goal of treating a medical condition, was one of the most common procedures performed by doctors. The belief was if a person was ill, there was an imbalance in the body. And the thought was to release blood over several days, this would restore the balance to the body. But there were a lot of risks to bloodletting. It puts people at risk for infections, organ failure, and even death, with the most common cause of death being blood loss. Do you think we still use this practice today in medicine? Yes, it's no longer used to treat every ailment under the sun, but in a very limited way, it can be quite useful. If a patient has, say, hemochromatosis, for instance, doctors will in fact remove blood from your body on a regular basis. But nowadays, it's done more like donating blood than yesteryear's bleeding out process. Number 4, a radical medical procedure, a lobotomy. Our next barbaric and infamous medical procedure may be the most feared of all time. The lobotomy was a surgical procedure in which the nerve pathways in a lobe or lobes of the brain were severed from those in other areas. The belief was that mental illness was caused by faulty connections between the frontal lobes and the thalamus. So the idea was that severing these connections and regrowing them could treat symptoms and agitations of the mental illness. Sounds maybe kind of, sort of reasonable, but what if I told you that this radical therapy was performed with an ice pick?
That's bad! Oh, that's bad!
And patients were not always anesthetized and often left in a vegetative state. Brutal, for sure. First performed in Portugal by a neurologist, the procedure was later adapted and popularized in the United States in 1936 by Walter Freeman. He performed tens of thousands of lobotomy procedures, and yes, he used an actual ice pick-like tool to hammer into the corner of an eye socket and jiggle into the prefrontal portion of the brain. This 10-minute procedure was believed to help patients with schizophrenia, manic depression, bipolar disorder, and many other mental illnesses. According to records, there were about 40 to 50,000 lobotomies performed in the United States, and about a third of the lobotomies were considered successful. However, some were paralyzed during the procedures, some left devoid of personality, some died throughout the process. And in 1967, Freeman was banned from performing this procedure after his patient suffered a fatal brain hemorrhage.
Ban!
Do we still use this procedure to treat mental illness today? No, not exactly. Although the lobotomy procedure was used well into the 1960s in the United States and even into the 1980s in other parts of the world, today shock therapy and other psychosurgery occasionally are used to treat patients whose symptoms have resisted all other therapies. Number 3 most terrifying medical procedure, trefination or trefination. Trefination, aka drilling or scraping a hole into the skull, is one of the most brutal sounding and surprisingly oldest forms of surgery that we know of. For instance, at a burial site in France dating back to 6500 BCE, tons of prehistoric skulls have been found to have trefination holes in them. Some experts believe it could have been that ancient humans may have done this as a way to, quote, release demons from the skull. Some Neolithic patients did actually survive this demon dispelling procedure, as there is evidence of healing on ancient skulls that have been found. What do you think? Is this alarming procedure still used today in medicine? Well, sort of. Nowadays, we do in fact use a more advanced version of this technique called the burr hole. This brain surgery is often done after mild to even severe head injuries that have occurred. In this procedure, a neurosurgeon will drill a small hole into the skull in order to drain excess blood from the brain. I can't say I've ever seen a demon come out though. Number 2, a rhinoplasty. Rhinoplasty, as we know it today, is a surgery that changes the shape of one's nose. This can be done to improve breathing, for cosmetic purposes, reconstructive purposes, you name it. But back in the 16th century Europe, however, the motivating factor for this unpleasant procedure may have been the result of the syphilis epidemic. You see, syphilis showed up in Italy in the 16th century.
Look who decided to show up.
Allegedly carried by sailors after they went out into the world exploring, syphilis develops in stages with symptoms varying per stage. One of the lesser known symptoms of syphilis, it can also destroy the soft tissue of the nose and lead to the collapse of the cartilaginous bridge of the nose. This is why one Italian surgeon, Dr. Tagliacozzi, developed a method for concealing this nasal syphilis-induced deformity. He created a new nose using tissue and skin from the patient's arm. A skin flap would be connected between the arm and the face. After 3 weeks of the awkward nose-arm growth process, the skin graft could finally be completed. The doctor would then separate the skin from the arm and finish reconstructing the previously damaged nose.
Love your new nose.
This procedure wasn't always the most reliable. There are reported cases of patients' noses turning purple and blue in cold winter months and falling off. So, do we still use this old-timey rhinoplasty in today's modern world? Not exactly, although the foundation is there and we do use skin grafts and reconstruct noses for all sorts of reasons. Luckily for us today, we have come a long way with reconstructive surgery, and syphilis is usually treated with an e-course of antibiotics. Number 1 unpleasant medical procedure, a lithotomy. Cutting of the stone was a jaw-dropping procedure used by everyone from ancient Greeks, Romans, Persians, all the way up to the early 1800s. Put very simply, it was a procedure that was used to remove bladder stones. Bladder stones are hard masses of minerals in the bladder, and it could be crazy painful. This was in fact a miserable, excruciating old medical procedure that I'm about to describe to you, so put down your lunch maybe. In an old-time lithotomy, a patient would lay on their back, feet spread apart, while a blade was passed through their perineum. You know, the spot between your genitals and the anus. Yeah. Then from there, other surgical tools may have been inserted into the urethra or the rectum to further assist with removing the bladder stones. Intensely painful. And did I mention it had a 50% mortality? I know what you're thinking. Is this crazy procedure still used today? Yes and no. Today, if an adult gets a bladder stone, which is super rare, doctors will do a procedure called a transurethral cystolitholepexy. For this, the surgeon inserts a small rigid tube with a camera at the end into your urethra and up into your bladder. From there, they do a lithotripsy treatment, which they use ultrasound shock waves to break up the stones into smaller pieces that can then be passed out of the body, much less painful. And you use lidocaine to numb up the urethra. Alright, that's been a quick breakdown of some unpleasant medical procedures from our past that we still kind of use today. If you guys found this video interesting, make sure you binge watch this entire playlist right here, and my limited run merch just dropped, so please check it out. And as always, make sure you subscribe. Thank you so much for watching, and stay healthy, my friends.